Okay, so as we look at the schedule, okay, the I don't have a whole lot for you. I have some of you were walking in before I pulled that screen down. One of the aspects that, as a practicing physician or doctor, would want to know is if you are coming in as a patient, okay, what are you battling or dealing with that maybe a lab technician will help the doctor diagnose? Unfortunately, our bacteria will not be here till after our first spring break. I think you'll understand it this way, that we can't order bacteria in the fall. You can't order it in the spring, okay? Does anyone want to take a guess why this can't be ordered 6 months ago? Because it's got to be live, viable bacteria, okay? So every year it gets to be towards the end of this unit or chapter that, okay, let's get that ordered. But unfortunately, Miss Tiffany told me it won't be after our first spring break, so we're going to have to move on, but we'll come back to that activities in the lab. Yes? Flynn Scientific. I mean, one of the reasons for that is, okay, I understand you can find bacteria everywhere. You could swab the surface of your skin, okay? You could swab your mouth. Yes, you will get bacteria, but I don't think you'll know the answer why we don't do that.
Unsanitary.
Nope, that wouldn't be a problem. Yeah, but it is true. But yeah, I suppose you could say that's unsanitary, but that's not why we don't do that.
We might be sick.
No, and you might be, but that's not the problem. How many different types of bacteria you suppose exist on you? A lot. So when you take that sample, you have way too many bacteria to be looking at. So if you order from a scientific supply company, you know you've got one type of bacteria. And what happens is that when you treat that with the staining process, it will react accordingly. If you have all those different types of contaminants on there, it's going to throw your results off. And yes, we could save money in doing that, but let's just find bacteria on the kitchen floor, or a drinking fountain, or if you just get done with practice for wrestling, but you don't practice here, but for argument's sake, let's say we do, and afterwards you could take samples from the mat, I suppose, from a sweat sample. I think I think my microphone's blinking. Oh, maybe not. Okay. I think what can happen is different types of, whether it's a live virus like shingles or something to that effect, you don't want to be wrestling on a mat that has been exposed to different types of maybe nasty particles that, of course, your bare skin comes in contact with that, so it has the opportunity to spread. So I wanted to make sure that, yes, we are doing that, but with what I want to say, circumstance and control, we're going to have to delay that. So when it comes to different types of bacteria, I don't think you would know any treatments. Yes, I know antibiotics, but when you say specific antibiotics, you could, of course, say amoxicillin, penicillin, erythromycin, tetracycline. What's that? Okay. I'll take your word for it. There's different types that you could use. So I just have some imaginary ones on here that none of these would work on bacteria because they're pain relievers. Okay, but the higher the number, the greater the accuracy or effectiveness, if you want to call it that. If you follow the CDC for the last 18, 24 months or so. They call it efficacy, I think. This vaccine has a 90 rate. Or maybe after your second booster, if you choose to do that, efficacy just means its effectiveness. So this will be part of your exam on Friday, not the blank screen, but what's actually behind here. And it's your, you have to be able to determine that with questions that are asked. And we'll just make some imaginary, well, some real questions up, but the treatments here are, what we say, are imaginary. I know, you just can't wait to see this. We're just, oh my gosh, this just sounds so exciting.
Not really.
Okay. And again, this is to help you on smarter balance tests, but probably more importantly, ACT test scores for those of you who do take it, because you do have to be able to decipher, interpret, and apply knowledge when it comes to different types of graphs. So, if different types of medications work on gram-positive bacteria or gram-negative, remember, it is the greater the number. If you write this down, fine. If you don't write this down, that's up to you. I mean, what this does is allows you a little bit of practice. So I'll go ahead and hit pause and just allow you to catch up with this. So that information or that handout about the plague is also on your exam as well. So for instance, all right, if we look at this table here, a doctor receives a report from a lab tech about a patient, has no idea what that bacteria is. So that doctor, I don't know if it's positive or negative. What treatment would you say he's going to prescribe, or he or she would prescribe? Okay, the doctor, is it him or her?
Him.
What do they possibly presume that we don't know what it is, so we are going to prescribe this? What do those numbers mean?
There's no positive or negative, so therefore.
No, the positive has nothing to do with value.
It won't cause a worse reaction.
No. We said the greater the number.
I don't know.
What's efficacy that we talked about? Effectiveness, right?
Oh, come by others.
So the greater the number, the greater the effectiveness. So if you don't know, this has a 2 for both of them. 3 is the biggest number that you could have according to this graph. So that doctor, they will prescribe conbiotic, whichever way you want to look. I just made that up, okay? Then if this is the best that he could prescribe if he doesn't know, what's the worst thing he could do? That would be Advil, okay? Because that doesn't do anything to either gram-positive or gram-negative bacteria. Therefore, if it comes back, the test says it is E. coli, a different strain of E. coli that's gram-negative, they're probably going to prescribe what? Bayer, okay? And of course, none of these are going to work. We just made them up. Why would Bayer probably not work on bacteria? Bayer is a name brand of aspirin, okay? So, and again, we just made these numbers up just to give you an example of what it'll look like. You'll actually have real antibiotics on here. Again, this is just an example, okay? So if this works best for E. coli, which is gram-negative, if they have a type of gram-positive bacteria, they know that, then they will prescribe what? Probably aspirin, because that has the greatest effectiveness, okay? So the bigger the number, the greater the effectiveness. So some will work on both. Some of them don't do anything, and some of these will actually, per se, be more effective on one than the other. Notice that there isn't one that's 3 and 3, and that was intentional. Okay, so just so you can look at this and try to decipher. Okay, so which one we don't know. Well, then prescribe this one. Okay, and if we know that it's E. coli, we're going to prescribe this one. If it's ML, we're going to prescribe that one. And whatever you do, don't give Advil, which is a type of ibuprofen anyway. That's more so of an anti-inflammatory drug. Okay, so you have those questions from your handout about the plague. You have this and your vocabulary. Okay, and we've got the next couple of days to go over things, but this is hopefully a good start. And don't forget the page of guided notes that were given to you that we read together in class. Don't forget those as well. Left side, we're on the bus. Middle, right side. Okay, so we will catch up to you next time.